Renowned travel writer Tom Coyne talked about how his father used to say that there are only two things a person leaves behind: their children and the impact of their actions. A fundamental truth is that actions that serve no higher purpose will, in the end, look small and insignificant. Most people know this and either explicitly or intuitively want to be a part of a collective purpose that is larger than their own pleasure, that gives meaning to their lives and the passage of time. These are the people we celebrate and honor because their compassion, leadership, and passion brings the greatest gift of all: good health.
The foundation has made a difference for me. Since I retired, I have been able to focus more on the community and helping the people. I currently work in the East Lobby in the same-day surgery area, and I love assisting the families and helping everybody be calm about their family members' procedure. And I like to help them get what they need. If they need coffee, blankets, anything. And I'm just there to really ease their attitude about everything.
Firstly, I have a personal connection to cancer. I lost my son when he was only 4 years old to leukemia. So it's a way for me to give back to the community for a cause that, that touches at my heart and is, has deep personal meaning to me. So that, I feel good about the work that I do for the foundation, and that's one of the reasons.
When I think of the work that's been accomplished here in this community by CMH and the foundation, I'm truly humbled, because when I look at the results, the results far exceed the sum of the parts. Somehow the people who have come together and the leadership and what's been done, the results just far exceed the individual efforts. And watching the evolution of the hospital and the healthcare system here and the community's growth, I'm just humbled to be part of it, and to think that I've played a small role in the future that will come makes me smile.
I believe that I have a vested interest in this community, and one of the things that I was privy to when I first came back from college was the hospital went through, physicians here went through a lawsuit that involved peer review, and it went to the United States Supreme Court, and it totally decimated this community as far as the medical community went. It was just ashes. And I have seen this hospital rise out of those ashes, and it was just, it's made me feel good to be part of that.
I think the importance of the foundation to the hospital and the community at large is just, it manifests itself in many ways. I think primarily it helps the hospital become more visible to the community. It helps the hospital become more successful in the service it provides to the community. I think it just kind of integrates the hospital into the community at large, and I think it makes a huge difference. I mean, living in a community, you want to have good health care along with good education resources and assets, good public safety, beautiful environment. Those are the things people really cherish where they live, about where they live. And I think healthcare is really one of the top, if not the top criteria, and anything we can do to support that, to enhance it, to make it better going forward, I think is just a big plus.
I decided to try it, and as I started learning more about it, I saw the different aspects of philanthropy, specifically the foundation, and the benefits that it provided to other people, specifically those in need that were employees. There was the Friendship Fund I thought was really an awesome idea for those that were maybe in need, and also providing more care to the community. So bringing different physicians, different recruitment, different facilities like the cancer facility, all these different things that have come through the donations of others, and I wanted to be a part of that.
I think in small ways, at least in my work on the finance committee and the foundation, helping people with both inside the hospital and out with small obstacles, pay the heating bill for a cancer patient, those sorts of things always give me a sense of satisfaction that I'm actually doing something good for somebody. And in larger ways, the foundation, I would point to the Cancer Center. Foundation played a pretty good-sized economic role in helping get that turned into a real thing. I think it's making life better for a lot of people in this area, and again, in the community I grew up in. So I feel like it's made a difference.
I'd just like to thank the dedication of our foundation board members and the role that they play in our foundation. They spend a lot of time volunteering for events, making asks from our donors, and they sometimes go unrecognized, but they're a critical piece to this foundation and kind of the life of the foundation. So they deserve a big thank you, as do all of our donors who have given throughout the course and the life of the foundation. Many of them have given money to us from the inception of the foundation through today, and their commitment to Columbia Memorial Hospital through the foundation just deserves a huge thank you.
Thank you to the CMH Foundation Board of Directors for creating an inspiring future and serving as the anchors needed to turn that vision into reality. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Margaret Mead.